My name is Mabvumbe, and I'm the Director of Planning and Policy Development in the Ministry of Health and Population. Let me mention from the onset that our biggest priority, is to ensure that all Malawians have equitable access to universal health coverage. So anyone who needs health care at the point that one needs it should be able to access that health care. And as the ministry, we are there for policy guidance. We are there to make sure that quality is there when we are delivering health service. Challenges as we execute our duties, there are so many. The first one, key challenge I would say, is financing. We've seen reduced funding over the years towards the health sector. That is both from government side as well as donor side. So with the little resources that are there, we cannot afford to provide the care that is required for people out there. The other challenge that we have in the sector is personnel. We do not have the required personnel in terms of doctors, in terms of nurses, in all categories, pharmacists, lab technologists. There's still up to now limited people that can do these duties, and we are struggling to provide the service, and it is visible when you go to a health center, for example, where you can see even what we call health surveillance assistant, people that were recruited to do community work manning a facility, and that compromises on quality. The overarching policy is the health policy itself, the national health policy. Currently is at a final draft stage. It's with the OPC. We're revising the policy itself. And then we have this, what I call our Bible, the Health Sector Strategic Plan. This is the second, which runs from 2017 to 2022. We've just launched it in July this year. So everything pertaining the sector is in here. All our objectives are in here, and the challenges, everything else is here. And we even have an implementation plan in this strategic plan. There are other policies like the community health policies. We have other departmental policies, HIV, AIDS policies. We have I think I've told of the nutrition policy. So there are some policies that are approved at cabinet level. Those we call the national policies, and there are others that are approved by the minister, which are ministerial policies, but we have several of them. Where this health sector is structured, at this core is the ministry itself. So this is the headquarters. Apart from the headquarters, we have now the implementers or the service providers. So for the service providers, we have the central hospitals, which ideally are supposed to be acting as our tertiary hospitals, but because of their location in the districts that they are, we don't have district hospitals. So we've seen the tertiary hospitals also acting as district hospitals, providing primary health care and secondary health care on top of the tertiary to people living in those districts. Citing example, we have Queen Elizabeth Central Hospital, we have Kamuzu Central Hospital here in Lilongwe, we have Mzuzu Central Hospital in Mzuzu. we also have Zomba Central Hospital in Zomba, and in all these districts, we don't have district hospitals per se, maybe apart from Zuzu where we have Mzimba, but because of the district itself, the magnitude of the district and population, we needed to have Zimba South and Zimba North as 2 district hospitals. Everyone else is a player, starting from the patient. At the core is the patient. So each and every citizen is a co-player to the health sector. But let me recognize that government is the main, where the owner of all the hospitals, all the health service lies in the hands of the government. And then we have donors. For donors, we rely, I would say, over 75% of financing for the sector it comes from different donors. And then we have faith-based organization, what we usually call CHAM, Christian Health Association of Malawi. So for the CHAM, we see they own about 30% of the facilities in Malawi. And then we have private providers, private hospitals, private clinics. These are about, I think about 10% in Malawi. So yes, so we see government being a key stakeholder. We have donors, we have CHAM, and we have private. Thank you. Do's and don'ts. Do's: coordinate with the ministry. We have the Department of Planning and Policy Development, which coordinates where we need, which coordinates all activities for health. In terms of infrastructure development, we need to go into a dialogue with those that would want to invest in health, and then we guide them where services are needed most. We guide them at what level they should put those services. So if they discuss with us, they are in line with government priority. And I said we have the health sector strategy plan, and I referred it as our Bible to the health sector. What we would want is each and every person that is coming into the health sector to invest, to assist, should abide by the objectives, strategic objectives that are in here. So if we are on the same page, yeah, I think that will work. With the decentralization, let me focus on decentralization to answer your question. We have the headquarters, which is concentrating now on policy guidance, because no matter what, it is the Ministry of Health, it is the Minister of Health that oversees all health matters in Malawi. So at the headquarters, there are departments that are looking into this just to make sure that there is policy adherence. At the same time, at the headquarter level, we also are mandated to make sure that there is quality for the services that are being offered out there. So quality management is another issue. With the decentralized structure now, service delivery itself, it's now the mandate of the district councils. So in the councils, we have the DC, who is the controlling officer for the district, and he or she has several sectors to look after. So health is one of the sectors in the districts. And for the health sector, we have the director of health and social services that is mandated to oversee all health issues in the districts. So under the director would be the district hospital, would be all the community hospitals, would be all the CHAM facilities, and would be all the health centers at the lowest level.